COVID-19 is a disease caused by the virus SARS-CoV-2. The virus can affect people differently. How may HIV affect your COVID risk? For people living with HIV, the three main risk factors that can increase the risk of serious illness from COVID-19 are a weakened immune system, underlying health conditions, and older age. If you are on HIV treatment with an undetectable viral load and a strong immune system with a CD4 count above 200, you are not expected to be at higher risk of severe illness from COVID-19. However, if you are not on HIV treatment or if you have a low CD4 count, you may be at increased risk of severe illness from COVID-19. Some people living with HIV may have other underlying health conditions that are known to increase the risk of serious illness from COVID-19. The risk of serious illness from COVID-19 also increases for everyone with age, regardless of HIV status. What can you do to protect your health during the COVID-19 pandemic? Stay engaged in healthcare and manage any related health conditions to remain healthy and minimize your risk of serious illness from COVID-19. If you are not on HIV treatment, consider starting treatment as soon as possible. If you are on treatment, ongoing adherence is also important. Take your medications regularly as prescribed. If you are having trouble sticking to your treatment schedule, discuss this with your healthcare provider to help find solutions. Try to stay up to date on vaccinations, including the annual influenza vaccine. These can prevent complications if you become ill with COVID-19. There are now vaccines to prevent COVID-19. These are safe and effective in people living with HIV. Check with your local public health unit or talk to your healthcare provider about when these might be available for you. There are other ways you can look after your physical and mental health during the pandemic. Try to get fresh air and regular exercise outside your home if you are able to. It can also be helpful to establish a routine, whether you are working or not. It's important to regularly connect with others, especially if you live alone. Try using video or phone calls to stay in touch with family or friends. If you find yourself feeling depressed or anxious, talk to your healthcare provider. You may be asked to self-isolate if you have been in contact with someone with COVID-19 or if you test positive for COVID-19. Discuss how you could get food and medications with your friends, family, or healthcare team. During the COVID-19 pandemic, there may be some changes to your HIV care. Your regular monitoring appointments with your healthcare provider or lab tests may be less frequent. Video and phone calls may replace face-to-face appointments with your healthcare team. Despite these changes, it is very important to stay engaged in HIV care. There may also be some changes to the way your medications are dispensed. Discuss your options with your healthcare provider and your pharmacist to make sure you always have enough medication on hand. For more information, visit kady.ca or consult your local public health unit.